Hi, and welcome to the Week in Politics with Michelle Grattan. I'm Caroline Fisher. I'm an Assistant Professor of Journalism at the University of Canberra. Hi, Michelle. How are you?
Hi, Caroline.
Well, over the past week, we've had some encouraging signs on the health front that, that the number of infections is falling, the curve is flattening, and the national conversation is very much turning to the way out, the economic recovery. This runs the risk, though, of course, of a second surge of infections. The government has talked about a tracking app as one of the ways to mitigate that second surge. But as we talked last week, there's concern about the privacy around that app. Do you think the government has adequately communicated the role of the app, the type of information it's meant to collect and what they're going to do with it? Do you think that they've communicated that well enough?
No, I don't think they have at this stage. Of course, they haven't formally launched the app, and that will come over the next few days, but it will be accompanied by communications effort, and I think that will need to be very convincing, desirably using the authority of health professionals to promote the importance of this app. And I think that the government will have a reasonable case if it can really communicate that case effectively. That will be the challenge. We've seen, for example, in Singapore that the take-up of such an app has been much lower than desirable. There's talk of the need to have a 40% take-up if the app is to be effective. However, some experts say the take-up would have to be much greater than that. But I think even though there is a trade-off with privacy, that nevertheless the app would be a useful tool, and that trade-off would be worth making.
I mean, like you say, in Singapore, the take-up rate hasn't been great. I mean, I think it's less than 20%. The community in Singapore is fairly law-abiding or rule-abiding. Yes, I mean, only less than 20% of Singaporeans are downloading the app. What is the likelihood of that happening here?
It's hard to say. People have been very compliant with measures that the government has so far put in place, particularly the measures the states have been enforcing. But there does seem to be a bit of a hiccup with the idea of the app, a bit of a drawing of the line. But nevertheless, I do think it should be possible to persuade people that really this doesn't have serious privacy concerns. After all, how it would work is that if you got the virus, you would have to give permission, even having downloaded the app, you'd have to give permission for it to be used. It would be used by state health authorities simply to trace the people that you had been in contact with in the last 2 or 3 weeks. And then that would mean they could be tracked down quickly and told to isolate or whatever.
What about legislative protections? Do you think if there was some type of legislative protection put in place, that would give the public some comfort rather than just taking the word of the government that it wouldn't be used, the information wouldn't be used for other purposes?
Yes, I think ideally it needs to be surrounded by a number of protections, and that they should be, if possible, in law. Perhaps a sunset clause on the whole project, but we do know that the information would be deleted in 3 weeks anyway. So after 3 weeks, the contacts you'd had would be wiped out, and of course there'd be a rollover and there'd be a new lot of contacts. But I think that it is possible to give a number of protections, and after all, you're really not giving a huge amount of information away. You're only giving away the fact that you've been face-to-face with certain people over that time.
Okay, so despite a bit of concern around this app and privacy, opinion polls are showing, though, that the public think the government's doing a good job in managing the crisis. Do you agree?
Yes, I think so. Obviously, you could criticise particular measures, but overall, I think that the government acted quickly on some of the travel restrictions from overseas. It probably should have acted more quickly on an even wider clampdown on overseas travel, but that is in hindsight. And we are seeing from the figures that we have flattened the curve. We're getting quite a small number of new cases coming. We're not getting a significant level of community transmission, and I think that basically the community has settled into the new regime of measures. Now, people are, however, very anxious, of course, to see some of these restrictions being rolled back. So the next 3 weeks or so before there's a major review of them is going to be very important in terms of holding community support, but also extremely important. The debate is now turning to how the economy gets going after the pandemic has passed, or most of it has passed, and the government is signalling a big reform agenda.
So a Senate inquiry has begun into the management of the coronavirus here. Do you expect it to uncover anything uncomfortable for the government?
Well, that's hard to know because it's going to be a very long-running inquiry. The hearing so far has been looking back at when it all started and when information came in, questioning health officials. But as things go on, of course, it will be looking at the particular measures that have been taken. It'll look at programs that are put in place for the recovery, which we haven't as yet seen. So I would imagine that it would be quite an important watchdog in the months, indeed years ahead.
Okay, so there's extra scrutiny on the federal government at the moment, but it's also calling for greater scrutiny of China's role in all of this, and as well as the World Health Organization. Do you think that the standing of the WHO and China is going to be damaged by their handling and role in the pandemic?
Yes, I think so. I think that the World Health Organization hasn't performed as well as it might have, and there has, of course, been a lot of criticism. President Trump has said that he will not fund the WHO. Now, Australia says it does good work in the region, and we're certainly not taking that sort of action. But nevertheless, there has been a feeling, and I think that's probably well based, that the WHO has been somewhat soft on China in the earlier stages of the pandemic. As for China's role, well, there are a couple of issues here. Certainly, I think the question of the Chinese wildlife wet markets where there are wildlife, is one that a number of countries, including Australia, unhappy with that situation, and that's going to come under a lot of questioning, in China under pressure over that, because viruses do seem to start in these markets. Also, of course, there's been the criticism that China was not forthcoming, or as forthcoming as it should have been, in the first stages of this pandemic.
So in a piece of refreshingly non-COVID-19 news, the Treasurer this week announced a mandatory code would be developed by the ACCC between the major tech giants, Facebook and Google, and news media organisations. Why does the government see the need to take this heavy-handed approach? A voluntary code was already under negotiation.
I think in large part because the media has been quite hard hit in the pandemic, and of course advertising revenue has been under a lot of strain and in some cases collapsed. We've seen the suspension of a number of country newspapers, and so I think the question of whether these tech giants should be paying for content which they're getting from the media companies has just come into very sharp focus at this point. And clearly the negotiations haven't been proceeding very fast, and also this question of payment seems to have been a sticking point. So the government has tried to crash through here and say, well, if you can't do it yourselves, we'll ensure it's done for you by the ACCC.
The devil is definitely in the detail. I mean, how on earth will this actually work, and whether or not regional, small players will get an equitable share, whether the Canberra Times will end up with sort of, some slice of the pie, when it's competing with the other big, mastheads, etc. I mean, there's a lot of work to be done here.
Well, that's right. And I think it's also a question in relation to these regional papers as to whether this has really just been a tipping point, even an excuse to not print them anymore, because they were under a good deal of pressure already without this situation. So you have to wonder how many of them would come back, and even the aid package that the government has put in place mightn't facilitate that effectively.
So finally, Malcolm Turnbull's memoir, and we have that leaked already last week and we talked about it. So in the end, how was it received, do you think?
Well, the people who are mentioned and mentioned adversely in the memoir have all been, the government ministers have all been, of course, too busy to read it. They've had a good excuse that really they're concentrating on other things, can't look at the book, can't talk about that, and so they've been able to keep silent. It has been a convenient excuse. I'm sure they've been through the index and at least read the parts that concern them. The book has had some publicity, but of course not nearly as much cut through as it would have had in normal times. And Malcolm Turnbull's been doing his book tour virtually. He's out there selling the book. The Prime Minister's office, or a staffer in the Prime Minister's office, got hold of a copy and distributed it to all his best friends, who seem to be pretty numerous. The publisher was furious, and now a whole lot of people are being tracked down and presumably told to pay their money for getting these bootlegged copies.
And I'm sure you're right. I mean, it is a convenient excuse, COVID, to say, you haven't had time to read it. I'm sure there have been people, with a torch under their doona,
I think so.
That's right. Look, thanks, Michelle. I look forward to speaking to you again next week.
Goodbye, Caroline. Thanks very much. Talk next week.